Hello everyone. Today we are discussing very important and my favorite topic, ECG, electrocardiogram. So this is very important because in most of the medical emergencies, when patient comes to you with the chest pain, sweating or breathlessness, the first thing you do is ECG. So this is the important for a clinical practice point of view. Introduction and ECG, that is electrocardiogram, is one of the simplest and fastest tests used to evaluate activity in the heart. So it shows or it evaluate the activity which is going into the heart. Here, electrodes, which are small plastic patches that stick to the skin, are placed at certain spots on the chest, arms, and legs. So, the spots which are sticked on the chest, they are called as chest leads, and the rest which are sticked on arms and legs, those are called as limb leads. Then the electrodes are connected to the ECG machine by lead wires. So, this is the simple introduction. It records the electrical signals in the heart. Test results can help diagnose heart attacks, irregular heartbeats, which is called as arrhythmia. So, mainly heart attack and arrhythmias. An ECG is done to check the heartbeat. It shows how fast or how slow the heart is beating. That means the heart rate or heartbeat is detected by the ECG. ECG test results can help your care team to diagnose irregular heartbeats, which are called as arrhythmias, then previous heart attack. If the patient is suffering from or if the patient had an heart attack in past, then it can be diagnosed with the ECG. The cause of chest pain, it can be evaluated with the help of ECG. It may show signs of blocked or narrowed heart arteries. That means coronary artery blockage. It can be shown by ECG. The ECG also may be done to learn how well a pacemaker and heart disease treatments are working. So, whether the patient is having pacemaker or not, that can also be evaluated with the help of ECG. You may need an ECG if you have chest pain, dizziness, lightheadedness, or confusion, pounding, skipping, or fluttering heartbeat. Then fast pulse, shortness of breath, weakness or fatigue, reduced ability to exercise. So these are certain situations where you may need an ECG. If you have a family history of heart disease, you may need an ECG to screen for heart disease even if you don't have symptoms. The American Heart Association, that is AHA, says ECG screening may be considered for those at low risk of heart disease in general, even if there are no symptoms. Most heart doctors consider an ECG as a basic tool to screen for heart disease, although its use needs to be individualized. So, most of the heart diseases without any symptoms, the ECG is a basic tool to screen the heart disease. If symptoms tend to come and go, a regular ECG may not find a change in the heartbeat. Your healthcare team may suggest wearing an ECG monitor at home. So, this is another technique, that is Holter monitoring. So, there are several types of portable ECGs. One is Holter monitor and another is event monitor. Now, Holter monitor. This small portable ECG device is one for a day or more to record the heart's activity. You wear it at home and during daily activities. Event monitor. This device is like a Holter monitor, but it records only at certain times for a few minutes at time. It's typically worn for about 30 days. You usually push a button when you feel symptoms. Some devices automatically record when an irregular heart rhythm occurs. So, two types of portable ECG machines. Now, we will see principles of ECG. The ECG is based on cardiac action potential and cardiac conduction. The SA node generates the cardiac action potential, which is relayed down the cardiac conduction pathway, resulting change in the membrane voltage, that is potential, across the membrane of cardiomyocytes. This change in cardiac action potential results in continuous running of cardiac cycle. So basically, ECG is mainly based on the cardiac action potential and conducting system of the heart. The cardiac impulse transmits through the heart, spreads around the surrounding tissue, and finally reaches the skin of our body. This electric impulse in the skin is received by the electric electrodes of ECG machine, and it is processed to produce an electrocardiogram. So these are the principles of ECG. Now results. Your healthcare professional might talk to you about the ECG results the same day as the test. Sometimes the results are shared with you at your next appointment. A healthcare professional looks for heart signal pattern in ECG results. Doing this gives information about the heart's health, such as heart rate. So, what all you are going to see in ECG is heart rate. The heart rate is the number of times the heart beats in a minute. You can measure your heart rate by checking your pulse. But an ECG may be helpful if your pulse is difficult to feel or too irregular to count accurately. ECG results can help diagnose an unusually fast heart rate called tachycardia, or unusually slow heart rate also, which is called as bradycardia. So very slow heart rate is bradycardia and very fast heart rate is tachycardia. So ECG results can help to diagnose these conditions. So first was heart rate, then heart rhythm. How rhythmatically the heart functions. So heart's rhythm is the time between each heartbeat. It is also the signal pattern between each beat. An ECG can show irregular heartbeats called arrhythmias. Examples include atrial fibrillation and atrial flutter. Heart attack. ECG can diagnose a current or previous heart attack. The patterns on the ECG results can help a healthcare professional learn which part of heart is damaged. So from the ECG, it can be evaluated that the which artery is stenosed or which artery is blocked. Blood and oxygen supply to the heart. ECG done while you are having a chest pain symptoms can help your care team learn whether reduced blood flow to the heart is the cause. Heart structural changes. ECG results can provide clues about an enlarged heart, that is cardiomegaly. Then congenital heart defect and congenital heart condition. So mostly the valvular conditions like mitral stenosis, aortic stenosis, mitral regurgitation, aortic regurgitation. If results show a change in the heartbeat, you may need more testing. For example, you might have an ultrasound of the heart which is called as echocardiogram. So whenever there are changes in the ECG, then you might need to do the echocardiogram.